All right, let's jump right in. And this explainer, we're going to build a fortress. And that fortress, it's the skin. We're going to visually map out exactly how this incredible defense system works, what happens when it gets breached by invaders, and maybe most importantly, how we, as clinicians, can fight back to keep it safe.
Okay, so here's our game plan. First up, we'll get the blueprint of our fortress, the skin's normal function. Then we'll dive into what happens when there's a breach and how the body starts to heal. After that, we'll get to know a couple of common invaders, both bacterial and viral, and we'll wrap it all up with the must-know tactics for defending that fortress. Sound good? Let's go.
First things first, let's talk about our fortress. I mean, before you can even think about defending it, you've got to know the layout, right? Understanding the skin's normal structure and function is without a doubt the foundation for everything we're going to talk about today.
And get this, it's so easy to forget just how massive this defense system is. We're talking about 20 square feet for the average adult. That's huge, and it weighs around 9 pounds. So no, this isn't just some plastic wrap keeping our insides in. It is a vast, living, breathing shield. And this is where the skin's genius really shines. It's not just a wall, okay? It's active. It's out there fighting off infections, regulating your body temp, making vitamin D just from a little bit of sunlight, and, of course, giving us our sense of touch. It is an absolutely dynamic, multitasking organ, and honestly, we couldn't survive without it.
Okay, so what happens when that fortress wall gets a crack in it? Does the body panic? Nope, not at all. Instead, it launches this incredibly organized repair sequence. It's like a cascade of healing events all kicking off at once.
So think of it like this. The body sends in a specialized repair crew that works in 3 distinct phases. First is the inflammatory phase, where they clean up the site. Then you've got the fibroblastic phase, where they start laying down new tissue. And finally, the long haul, the maturation phase, which, believe it or not, can last up to a year, just remodeling and strengthening that new scar tissue. Now, this whole perfect cascade can get thrown off by things like poor nutrition or diabetes, which is absolutely critical to keep in mind.
All right, this next part is super important, especially for your exams. Not all wounds heal the same way. We call this healing by intention. So first intention, that's your clean, neat surgical cut that gets stitched right up. Second intention is when you've got tissue loss, like a pressure injury, and it has to heal from the bottom up, a much slower process. And then there's third intention, where we actually leave a wound open on purpose, usually to clear out an infection, before we close it up later. Okay, as a nurse, this is your bread and butter. Assessing wound drainage. It's literally like reading a live status report from the wound itself. And this table, think of it as your secret decoder ring. The color, the consistency, it tells you everything. You see that clear, straw-colored serous fluid? Good, that's normal healing. But if you see that thick, yellow, purulent stuff, red alert, that's infection. You absolutely cannot miss these cues. So a breach in the wall, well, it's pretty much an open invitation for unwelcome guests, right? So let's profile a couple of the most common bacterial threats that love to exploit these weaknesses. We're talking about MRSA and cellulitis. Now, cellulitis is not just some little rash on the surface. No way. This infection is smart. It bypasses the outer defenses and sets up shop way down in the deeper layers, the dermis and the subcutaneous tissue. And that depth is exactly what makes it so serious. It's why you get such a huge, widespread inflammatory reaction. So how do you spot it? Well, that deep infection triggers the body's classic alarm bells. You get pain. You get redness, that's from all the extra blood rushing to the scene. You get warmth, for the exact same reason. And you get swelling, from fluid leaking out into the tissue. When you see those classic signs together, especially with a fever, your brain should immediately be screaming cellulitis. And then there's MRSA. Think of it as the superbug version of staph. Its real danger is its armor. It's resistant to so many of the antibiotics we'd normally use. And what that means is that a seemingly simple little infection can turn into a huge problem fast. This is why spotting it early and getting the right treatment is so critical. All right, let's switch gears. We're going to look at a totally different kind of threat. This one doesn't invade from the outside. No, this is an inside job. It reactivates from within, and it uses the body's own nervous system as its personal highway. Okay, for your exams, I want you to burn this visual path into your brain. Really visualize this. So you get chickenpox as a kid.
The virus doesn't actually leave your body, it just goes to sleep. It lays dormant in a nerve root. Then, years, maybe decades later, if your immune system gets a little weak, it wakes up. And when it wakes up, it travels down the path of that one single sensory nerve all the way to the skin, and bang, it erupts. This single pathway explains absolutely everything about how shingles presents.
See? This is a perfect example of how pathophysiology leads directly to the symptoms you see in your patient. Because it follows that one nerve path, the rash is unilateral. It literally stops dead at the midline of the body. That is a huge diagnostic clue. And that intense burning pain that people describe, sometimes even before the rash shows up, that's the virus irritating the nerve as it travels. It all connects.
Okay, so we've seen the fortress get breached, and we profiled a couple of the bad guys. Now it's time to talk about how we fight back. Let's get into defending the fortress. What are our key diagnostics? What are our go-to interventions? A huge part of defense is surveillance. In this case, surveillance for skin cancer. And you absolutely have to know the difference between the main suspects. You've got basal cell carcinoma, which often looks like a pearly or waxy little bump. It's the most common, and luckily, it rarely spreads. Then you have melanoma. This is the one you really have to worry about. Irregular borders, weird colors. Those are the red flags for a cancer that can spread aggressively. And just look at the visual difference here. It's night and day. On top, you see the basal cell. See that classic pearly look and the well-defined border? It almost looks polite, contained. Now compare that to the melanoma on the bottom. Look at the asymmetry, the jagged edges, the mix of tan, black, and blue. That chaotic appearance is a huge clue to its aggressive nature. Being able to spot this difference can literally save a life.
Okay, so when you have a patient with an active shingles infection, our interventions are designed to directly counter the pathophysiology we just talked about. We put them on contact precautions. Why? Because the fluid in those vesicles is contagious. We do comfort measures like cool environments and loose cotton clothes to soothe those irritated nerve endings. And of course, we hit the virus directly with antiviral medications to try and shorten the whole miserable ordeal.
You know, when it comes right down to it, the best defense is a good offense. And that is 100% about patient education. When we teach our patients how to do monthly skin self-assessments, we're not just giving them a task. We're empowering them. We're turning them into the first line of defense, the primary guardians of their own fortress, so they can spot trouble when it's small and easy to deal with. So this all brings us to one final, really important question. What's the single most effective habit you can teach a patient to protect their body's largest organ? Because beyond all the high-tech treatments and interventions we have, our most powerful tools will always be prevention and education. Teaching that vigilance, that's the ultimate way to defend the fortress.